So before we start, one thing that I will say is in this field, you'll require to work really hard. And I'm not talking just putting in hours of academic excellence. I'm talking about serious hours of research. So why dentistry? To be very honest, when I started off with dentistry, it was more of a thing where I took it as a second option to my MBBS. I had qualified for the medical schools everywhere, but they were all private, and the fees for the private medical schools was really high. So I got a scholarship in one of the top dental schools, that's Martiniere College of Dental Sciences, and that's how I chose dentistry. So I had to, over a period of time, learn to fall in love with the subject. Something that I did realize later on was that dentistry is a very novel course of its own. You know, there are so many more options that are opened up or are opening up to students, and if you go about it the right way, then you can actually have a very prosperous career. So first of all, with dentistry, the best thing that I feel is it's not very highly demanding as in medicine. You can earn a lot and you can put in the same amount of hours and you can have some personal time for yourself. Whereas the more that you advance in this field, you'll find out that there are much better options for you outside available. There is much more demand for dentists outside of this country. So that is something that is to look forward to. So I would advise anyone who has an actual practice already set up with their parents, or someone who has a lot of keen interest in dentistry, they should really look into this field. The top Indian dental schools. Over here, I would like to inform you that studying from a government college will help you a lot. It will definitely. If you get into Maulana or say Nair or a government dental college anywhere in Mumbai or a PGI, definitely one of the best. But I feel exposure is also important, and for that I would recommend colleges like Manipal, Savita in Chennai, and A.B. Shetty in Mangalore. These are really good colleges, and the graduates from these colleges do really well. So you need to assess yourself. You need to ask yourself whether you're looking for good exposure, good research facilities. If you're looking for that, I would advise you to join a private institute. But even for a private institute, you'll have to score a really good rank. And if you get a government dental college, nothing like it. I mean, I came from a middle class family background, and it would have been better for me to do it from a government dental college. I got a free ship in Manipal, so that's where I think I was very lucky. And so for all scholarships, you'll have to score really well. So these are the top dental schools: Maulana, Manipal, SDM Dharwad. These are some highly recommended colleges. Also, A.B. Shetty and Savita. Savita is a very good institute for research, but they charge heavy fees. So please assess what kind of college you want to join based on your financial condition. Foreign settlement. Well, for foreign settlement, I think dentistry is, if not better than banking. It's a high investment field abroad, but the returns are just borderline obscene. I mean, I know of dentists who are making $250,000 in their starting years, and that's for a year. So it's definitely very high returns. But if you want to do it the foreign way, the options that you have is, which I would highly recommend, is that you take a BDS degree from one of the colleges in India, then you build up your CV, then you apply for your DDS admissions. That will take you 2 years to complete a certificate licensing course over there, and then you become a DDS. If you're going through the SAT program, you directly apply in the SATs, but that will be a long and tedious process. You'll have to sit for another 4 years, do your pre-med courses, and then apply for another licensing exam, which will take another 4 years, but a total of 6 years. Either way, 6 years will be spent. I would advise you to do it via India. So you'll have a lot of options. You'll have the chance to work in the United States of America, and if you get a license for DDS, you can work anywhere in the world as a dentist. Options in Europe are good. The pay scale is also really good, but the problem is that in most European countries, you'll have to learn the language. You'll have to first pass the exams of European certifications in language. So for that, if you're good at language and communication, then definitely, why not? But I would say that if you're going to invest so much of time, it's better you invest somewhere where you're going to get really high returns. In Europe, I would recommend Germany and France and the Scandinavian countries. Also, United Nations is something which is very specific to my field. That's public health dentistry. Over here you get to do some really good work. The salaries are going to be good, but most importantly it's going to be very fulfilling work, which I personally feel is something which a main reason why I took public health dentistry is that you get to do the real work that you wanted to do as a health professional. You get to work out with people with whom you want to help, with downtrodden areas, and make a real difference. So people who are interested in actually contributing to health, they can be a part of this, and dentistry will actually help you get to those places. The kind of dental camps that I've done in so many states of India and so many villages, it's really fulfilling work, and I'm actually very proud of that work that I've done. And if anyone who's actually wanted to make a difference, dentistry could be a very good path for that. The investment. Now, this is a very important aspect of why I'm going to be sharing this with you, because what people don't realize is that this is a very high investment field. If you're someone who's belonging to a middle class family background, they will really need to weigh out the options, because these days, if you want to open a simple clinic in India, and I'm talking about like a city like Lucknow or somewhere, a tier 3 city, your minimum investment will be up to upwards like 30 lakhs or something, which is quite a lot, to be very honest. A simple dental chair, a decent dental chair where you want to have a X-ray machine or a micromotor or an endomotor, that's going to cost you around 20 lakhs. So it's a very high investment field, and you need to check all these flags, whether you'll be able to put up a clinic for yourself or you want to work in a college or a hospital. As for people who choose private schools, the thing is that the amount of investment that goes in your tuition, by the time you graduate, you don't want to put any more money into it. So if you're someone who's not financially well backed, you will really need to weigh out your options, and you will need to assess whether I can promote myself with more investment. Because if you want to stay in this field, you have to invest heavy and you have to invest big. So please check yourself financially. If you are coming from a dental background, then I would highly recommend this field. If your parents are dentists, you have that starting launch pad, which will further you very much into this field. I see a lot of co-batchmates of mine who have already had that starting background, and they just propelled themselves further and are doing really well. I'm not saying that people who are not coming from families of dentists should not consider this, but it's an honest truth. Being part of a career fair, it's my duty to be honest with you, that people who are already having setups, they're going to start at the finish line and you'll be starting from much behind. So please weigh out your options very carefully. The do's and the definitely do nots. First will be something that I did, and that's what I learned from my mistakes. Never take it as a second preference to MBBS. This requires a lot of dedication. This requires a lot of commitment. So anyone who's walking into this field thinking that, okay, maybe I'll be a doctor this way, no. My advice would be you first go and shadow a dentist in your nearby area. Look at it, how they are going about it, what all are the course requirements, what all are the subjects that you're going to study. Because the minute I entered into a dental school, they gave me plaster in my hand and I was like, okay, where are the patients? And it wasn't a very pleasant experience. It took me some time getting used to this field. So my request to all young students over there would be to make sure that you have done some research about taking this career. Do not be impulsive. This is something that I wasn't. I actually took a drop here and I weighed out my options, and I took some time getting used to it. So don't be impulsive in choosing. In fact, don't be impulsive in choosing science. Please check for your aptitude more than your marks. Your mark sheets are, I'm not saying they're not important, but the outside reality of this world is very different. You will end up doing much more better with what your aptitude than what your mark sheets are indicative of. Lack of interest. And when I say lack of interest, I'm talking about the overall subject of science, or because dentistry is science, and you need to be very, very well inclined with dentistry. So if you're not, you need to take a hard call. Don't jump into this to be a doctor or impress your parents. That is the last reason anyone should step into a field of science. This is an evidence-based medical field. This will require a lot of dedication and a lot of years of training. I've already been a dentist for around 7 years. I've been studying for the past 12 years consistently every day, and I have a lot more years of studying left. So please consider this as a dedicated field. Not researching future options. If you're not researching the background of the field that you're walking into, the pros and cons, the investment, where you're gonna, if you're planning to set up a clinic, if you're not thinking 10 years in advance, you're actually making a very bad call. This is a highly demanding field. You need to know, you need to have a blueprint. Nobody knows what's going to happen, but people who do not have that vision of a future road, they're going to build really bad bridges. That's what I feel. So please research well. Science and research interests, something that I did not know and I wish I knew. There's that this field requires a lot of research, a lot of reading up on text and writing research journals, and coming up with new techniques and new advents, something which they don't even tell you about in your college, in your undergraduation, and suddenly you're a postgraduate and they're talking about research. So you need to be a researcher. You need to read a lot of literature, scientific literature. Scientific literature is very different to fictional literature. So if you're a reader, don't believe that. You need to be interested in science, is what I'm trying to tell you. You need to be interested in reading ounces of literature and writing just one line, something which they should be teaching you in schools, because research science is very different to the kind of science we do in laboratories and schools. So you need to look about this term research very seriously. And the next one is obviously looking for fast settlement. If you're looking to find a job and settle down fast, this is not the field for you. This is going to take a lot of time. You're probably gonna, if you do end up being a dentist, you're gonna marry a dentist, because they will also be stuck up in the same field, not giving time to themselves. So if you're looking for a fast forward 5-6 years of studying, do like a BTech and an MBA, then this is not your field. You can't survive just with a bachelor's. You can't survive just by doing the bare minimum. You have to put in a lot of years. I hope I was able to do some justice to you all, and I would really like to thank Mr. Hitesh. He was my senior in school, for giving me this opportunity, and I hope I can return again and share the stage with all of you. Do well, study hard, love your parents, respect your teachers. We will Martiniere. Thank you.
Greetings everyone. For this episode of the Martiniere Career Fair, we have with us as our guest Professor Asim Prakash Tikku, who is an eminent personality in the field of dentistry. Sir joined BDS in the year 1978 in KGMC. He has done MDS in conservative dentistry from the King George's Medical College, Lucknow University, and Sir has more than 33 years of postgraduate teaching experience. He is one of the senior most postgraduate teacher in the country. He has taught and trained more than 1,600 undergraduates and 125 postgraduate students over the years. Many of them are now professors, heads, principals and deans at various dental institutions, and many are top private practitioners as well. He is the former Dean Faculty of the Dental Sciences and Executive Council member, King George's Medical University, Lucknow, and is currently Head of Department of the Conservative Dentistry, member, Dental Council of India, and Dean Alumni, KGMU. It is a pleasure to have Sir with us at this episode of the Martiniere Career Fair. Thank you, Sir, for being here with us at the second episode of the second season of the Career Fair.
So, as I said, thank you so much for being on the show. The first question that I would like to ask you is that dentistry is a very well-known industry. However, could you please explain the roadmap that an aspiring dentist should follow from the school up till their master's degree if they choose to pursue so?
Well, first of all, thank you, Viman, Avi, and Ayan Rizvi. Dentistry, I will tell you, is it's a very unique profession. It's a very unique profession. And unique, by unique I mean that if you compare it with the medical side, Then in medicine, you see, doctors are treating patients by giving medicines, by using their stethoscopes and other things. And many illnesses are treated by medicines only, like influenza, viral infection, or bacterial infection, or throat infection, or stomach infection, or kidney infection. Medicines are given by the physicians or the doctors, and they are treated. Now, dentistry is rather unique in the sense that in dentistry, most of the conditions are treated by hands. There are very, very few conditions which are treated by medicines. Whether you have to do a surgery, whether you have to make a denture, whether you have to do a filling, whether you have to straighten the teeth, whether you have to improve the smile, whether you have to do a restoration, whether you have to do a root canal treatment, or whatever, you have to do it with your hands. You have to use your hands to do it. And that is the difference. So I say always that dentistry is not only science, but it is an art also. You have to be an artist with your hands, and you have to deliver with your hands. So the first thing I will tell the students is, first, analyze yourself over these years, whether you are good at using your hands or not. In the sense that a sculpture, you can make a sculpture, or can you make a good painting? Can you make a good, anything you can fabricate with your hands, or modeling, or clay modeling, or something. Because all these things are in your college. I know all these extracurricular activities are in your college. And the students, by the time they come into the 11th and the 12th, get to know whether they can really use their hands well. So if you have the ability, or what I say is the tactile ability or the dexterity with your hands, then you have a very good future in dentistry. Because like I said, you have to use your hands. But at the same time, I see here that there are many students who come here who have rather limited ability using their hands, but we train them and we teach them, and with practice they can come up to the same level as the other students also. So this is all right. Dentistry is an art and a science, and it must be understood that most of the illnesses, or most of the diseases, or most of the dental conditions are to be treated using your hands only, not by medicines, not by giving only medicines. That is one thing.
So it is great to know that you believe that dentistry is as much as art as much it is science. So could you please elaborate on how you consider this to be an art, and how can someone master this art?
You see, I say it is art and science because whatever you do in dentistry has a scientific basis. It is a science in the sense that whatever you are doing, you are reading in the books, you have been taught by your teachers. Like in biology, everything what you read is science, but what you are doing and delivering is by hands. So, for example, you have read that the filling has to be done in this particular way, or this particular way the cavity has to be designed and the filling has to be designed, but then your hands have to deliver it also. Your hands have to do it also. So you may be knowing the science, but if your hands, you are not a good artist, you will not be able to do a good restoration or a good denture or any good treatment that way. So you have to deliver by your tactile sensation, by using the dexterity of your hand, using the basis of the science. There is a scientific background. Whatever step, whatever actions your hands are doing has a scientific basis. Just not like that. It does not like that. That is what I mean to say.
Thank you, sir, for clarifying that.
Sir, it is a common belief that it is difficult for the doctors to manage their personal life due to some emergency cases that might arrive on a day-to-day basis. So do you consider the same for dentistry as well, or is it a privilege of the dental practitioner to maintain a work-life balance?
Dentistry is very popular, and it has been popular because there are two things which are very important. Dentists normally do not deal with life and death situations. That's one thing. Dentists seldom deal with emergencies where you have to get up in the night and run or treat an emergency. And it is not a life and death situation. So it's a very easier profession in the sense that it is not as stressful for the patient as well as for the dentist. The patients come here for their smile enhancement, for your pupil teeth, for straightening of teeth, for your better facial expressions, or for restorations, or for any other processes for cleaning, they are not under great stress, and the dentist also is not under any great undue stress. So this is a very easy profession in the sense that you can practice very easily without much of your blood pressure being raised at any point of time, and that is good for you and it is good for the family also, because you are not under any.
I'd also like to know that since dentistry, as you said, is a very well-renowned profession, however, the career field is very saturated because of that. So, what do you think is the current scope of dentistry as a career compared to the previous 10 to 20 years?
Dentistry, when I came into dentistry about 44 years ago, dentistry was at a very low rung in the ladder and was not looked upon really much. And the medical science was very developed, dentistry was not so developed. But over these years, we tried, and other people also tried to raise the level of the bar and raise the level of the profession, and it has come to a tremendous level now. And dentists are very well known, very well respected, and they deliver the best possible. Because today in India, we have all the expertise which is available in the world, all the materials, all the equipment which is available anywhere in the world is available in India. It is available with us, with the added advantage that in the West they may treat only 4 patients in a day, we treat 100. So our expertise is much more as compared to them, and we do it in a better way now. So dentistry has taken tremendous strides over the few past, say, 10-15 years, with the mushrooming of so many private dental colleges and passing out of so many students. Dentistry was experiencing a little slump. There is no doubt of it. But it is the survival of the fittest. This phase is not going to stay for very long. The dentistry will surge up again very soon, and the next 20 to 30 years I see a very, very bright future for dentistry, because the change in the scene is there is tremendous computerization. Everything is now computerized. There is incoming of the artificial intelligence. There is nano robotics. There is regeneration. There is cloning of the sheep dolly, and I'm sure there will be cloning of men maybe in the future, and cloning of teeth also, and so many things which are never heard of in the past 50 years are all on the brink of coming in the future. So dentistry is going to experience a very exciting time in the future, and it is the right time actually to come into the dentistry now.
Perfect, sir. Thank you so much for that answer. Sir, just to follow up on that, you talked about the survival of the fittest. So, sir, based on that, how can a new and budding dentist make a name for himself or herself despite the saturation which is there in this field?
I tell you, there is no shortcut to success. Anybody aiming for shortcut to success is heading for doom. There is no way professional doom. There is no way there the success will be short-lived only. For a dentist, rather than any other professional, the development of trust is extremely important between the patient and the dentist. For example, I will tell you, if you have a broken arm and if you work in an orthopedic, you can see in the X-ray yourself that your arm is broken, and the orthopedic will mend it or put a plaster or whatever, and after 6 weeks you will also be able to see whether your bone has healed or not. Alright? But what the dentist is doing inside the mouth, the patient simply does not know. Patient is only dependent on what the dentist is saying. That means it is the trust he has on the dentist. He is trusting what the dentist is saying. So my only advice to the budding is, do not betray the trust. Build the trust. Building a trust is not a easy short time process. It takes time, and that time you must get to the profession to build the trust. Never betray the trust, and once the trust is built, you will get success to the extent you have never imagined.
So that's really great to know. But that's a very unconventional thought actually, because it's believed that soft skills are not required in medical professions. So do you believe the same, or do you think soft skills such as building trust, building companionship is required and will help you to become a much better dentist?
You know, no other profession requires soft skills more than the medical profession. If you just say to the patient, you will be all right, have faith in me, I will see that you are all right. Half his illness is gone. He's already half all right before he reaches home. So soft skills are needed more in the medical and the dental profession than in any other profession. And I know there is a slope in this, we can, what the world is heading and what we can see every day. But I always advise my students, and I will advise you also, that in our profession there is a healing touch. I will say in Hindi that the term is shafa. It's the Persian word. The doctor ke haath mein shafa hai. That means this doctor has a healing touch. Everybody does not have a healing touch. The God only gives this healing touch only to certain doctors, to certain individuals, not to everybody. And this shafa, the healing touch, you touch a patient, the patient will heal you, whether you are expert or not. But what God sees, to whom will He give this healing touch? Ye shafa kisko dega upar wala? Anybody He sees has empathy, has sympathy, has kindness, has generosity, has honesty for the patients, for the public, in large everybody in large, for the poor and the needy, for the elderly. If you have this, the God gives you the healing touch. So these things, I tell them, if you have these things, these qualities in you, you will not be running after success. Success will come to you itself. But develop these, all these characteristics. They are most important. Be a good human being first. Any good doctor has to be a good human being first. If a person is not a good human being, no matter what skill he has, he will not become a great or an excellent doctor. That is for sure. I've seen it in 44 years. That's what I'm telling you.
Thank you so much. Sir, a follow-up question on that is the fact that there is quite a big discrepancy between the doctors who are considered to be creme de la creme and the fresh comers. So what are the reasons behind this, and how can the newly graduated doctors make a name for themselves?
This profession of medical or dental profession, and like I said, there is no shortcut to success, and the success is time consuming. A new doctor cannot hope to become what a senior or a experienced doctor is. He will have to put in those many years to become that. If you want to bypass the seniors and become famous and that, you may be indulging in certain practices which are not ethical. And like I said, that is something which is a short-term gain. It will not give you gains in the long run. So if you have to really do it, you have to give time. A dentist needs at least 8-10 years to settle down and have a stable practice. In this initial 7-8 years, you will see that the dentists are struggling, because not only dentists, even the medical specialists are struggling in the initial years. Even in the professional life, you want to go to the law, like my son has gone into law also, but now they also need, there is a buffer time. You need to have experience, you need to know the details, you need to experience the profession, you need to develop your skills, you need to have experience. All this will come with only time, and you have to give it time. You cannot be impatient for success. That is not the way good professional should approach the profession.
We're glad that you answered, not only talked about dental profession but also life in general. But I'm going to change that. What I'd like to ask you that in recent observations, dentistry has shifted from its conventional roots to cosmetic and digital industries. So what do you think this change will result in the near future?
It is very exciting. It is very exciting because the public, by and large, is now, paying attention to their smile, to their teeth, which they were not 20, 25, 30 years ago as much conscious about it as they are today. And you know, the slogan of the city where we have been born and where we are living, what is the famous slogan here? मुस्कुराइए कि आप लखनऊ में हैं. You see, the मुस्कुराहट and the smile has a tremendous impact in your life, in your profession, in your studies, in the way you deal, in your social life, in your success. Your smile has a tremendous effect, and you must, encounter life and encounter your difficulties, encounter your difficult smiles, difficult times with a smile. Keep smiling. And now that the patients are aware of the smile and the importance of smile, they are going in for smile designing, and we want to encourage that. You see, it was the high-end society which was actually more using this smile design and the enhancement of the smile, like in the film world, like in the modeling world, like in the fashion industry. They were all involved. They wanted, and they are getting these things done. But the common public and the common patients by and large, are now conscious about this, and they come here for smile design. Very recently, I tell you, there's a young girl who used to come here to get her teeth. They were yellowish in color, and she was very disheartened and very discouraged by that. And in her village, people used to taunt her. And that girl, maybe 24, 23 years old, used to travel alone, all by herself, from about 300 kilometers to come here for treatment. And she used to come in the morning, get herself treated, and go back the same day. And we give her the best possible smile, and she is very happy, and we are very happy. So this is what it is. The concept has reached also the villages, as far as we are seeing, and this will have a tremendous impact. And we want to deliver. We want the common person to get these facilities of the smile and the smile design, which was up till now the domain only of the high-end people, high elites. That is our intention. That is our agenda now.
So we're very glad to know that. Sir, I'd also like to ask you, we talk about smile design, which is a part of cosmetic dentistry, but there are various different avenues of the industry as well: dental implants, surgery, fixing teeth, dentures, root canal treatment. So since there are so many different avenues and so many different places, fields where a person could master, so do you think that some of these particular fields have a much more impact on your career, that they can propel you even further, or do you have anything to say about that?
Yes, dentistry has 9 specialties, basically, and some of them are dealing with clinical aspects, and some are dealing more with the theoretical, non-technical sides. Once the student has completed the BDS, that is the 4 years course, in those 4 years, he taught about all these 9 things at the undergraduate level. And he experiences all the 9 specialties, what work is done in various specialties in dentistry. Now, by the end of this term, by the time he is an intern, he gets an idea, or he should get an idea, what interests him more, and where he is capable, his hands. I may be a good oral surgeon, but I may not be able to be a good orthodontist. I may be a good person in designing smile. I may not be good in root canal treatment. That I will get to know myself by the time I finish my undergraduation. And my advice to the students would be, who are doing undergraduation or doing internship, that after that, whatever interests you, you take short special courses in that. There are many courses available. They are in the West also, in India also, all over the world. Attend those courses for 2 months, 3 months, 6 months, maybe 1 year, and develop that particular skill which you think you can do well. And that will help you in your practice.
Sir, this was something which I was not aware of, these special courses. So are there any other things which are very unconventional in what the dental students usually opt for, and would you like to discuss some aspects of these unconventional study methods that perhaps students can use to be much more knowledgeable?
Yes, you see, everybody cannot be a good clinician. That is for sure. All the students who come into the BTS curriculum, not all have the aptitude to become good clinicians. That we also see. So my advice would be that if you are not really good, you don't have the aptitude to be a clinician, there is a tremendous scope in research. There now the government of India, our government of UP is promoting research in a very, very huge way, and there are many government bodies which are funding but providing you do original good research, and you join these research centers. So there is an option for research. There is an option to join the Indian Army, which is an excellent option. But the Indian Army has limited options, but those also people who are fit physically and who are mentally inclined to join the Indian Army, because it's a different life. In the Indian Army, you are not a doctor first, you are first a soldier. So they have to be a soldier first, and then you are a doctor also. So both responsibilities you can carry, then join the Indian Army. Otherwise, research is an option. Practice is an option for people who are good in their clinical activity. If you are not good in the clinical acumen, then you either go into teaching, or you go into research, or you join the Indian Army, where you can do a lot of clinical work also, but at the same time serve the Indian Army also.
Yes, sir. Thank you so much for that answer. Sir, another question on that. We acknowledge the fact that there are certain risks which are always there with any profession. So, sir, once you tried to pick this profession up, what were the certain risks which you faced, and what are your recommendations to the youth who will pursue this particular profession in the future?
I have a very simple logic and a simple philosophy. No risk, no gain. I have done this in my life. I have taken all risks possible. I have done the riskiest of sports. I have taken the riskiest of steps in my profession. Because unless you don't take the risk, you don't go ahead. That's for sure. But the risks have to be calculated. It cannot be blindfolded. Some calculated risks have to be taken in life, and one must take those calculated risks in life. Do not be afraid of risks. If anybody is afraid of risks, then you are going to be stagnant. You will not go ahead. Take the risk. You may falter. Taking that risk, you may fail. But failures are the pillars of success. I can tell you. During my postgraduate exam, I tell you, I failed. And yes, many years ago. And many people fail here. I failed in my postgraduate examination. But it didn't deter me. I was never underconfident of my abilities or of my capabilities. And that is what you must also ensure. Should not never be underconfident of your capabilities and your abilities, and see that and believe in yourself that you can do the best. You are the best. You can do the best. And success will come to you. I have reached here. This is the topmost post in the dental profession. So it didn't deter me at all. It didn't matter to me at all. So what if there is a failure at some point of time in life? It's all right. Take it in your stride. Take it with a smile.
Thank you so much, sir. Here I would like all the viewers to make a note of two things which sir effectively pointed out. First is how we always need to take risks, how they are extremely important. Second, how we need to believe in ourselves. That is what we as the youth need to do. This is sir's recommendation which I would like to highlight once again in this series of podcasts. The final question for today, sir, is there any piece of advice which you've already received from you, but in particular, is there any piece of advice which you would like to share with us?
The advice is go for dentistry, and it is a very, very exciting prospect in the next 30 years. It's a very exciting prospect. There's so many developments, so many technical advancements coming in, on the verge of coming in. But after 4 years of taking this curriculum, undergraduation, if you still feel a little hesitant or a little unsure, then leave dentistry. Do not continue dentistry. Take it as a graduation. When you have done 4 years of graduation, you are a graduate. Look for other streams. Go to other avenues. Go for other professions. It can be done. You can take it as a profession. But if you are sure that you are going to pursue it, then focus on either the developing your clinical skills, or focus on developing your research skills, or focus on developing your academic skills. That you have to. Because like I said, the crux of the story is it is now going to be the survival of the fittest.
Thank you so much, sir, for that podcast. It was not only just informative, it was very fun talking to you, sir. Thank you so much for being a part.
I enjoyed myself. Thank you.